So, hello everyone. In this video, I'm going to explain about the signs of liver failure in a very crisp and precise manner. Remember, this is a very wonderful picture which is given in our Macleod textbook, which will help us to explain the various signs of liver failure or chronic liver disease from head to toes. Remember, in eyes, jaundice, icterus. Icterus is nothing else but the yellowish discoloration of the sclera. Remember, sclera has very high affinity for bilirubin. That is why it is very well appreciated in sclera. There is another condition in which the whole body will be yellowish in color, but the sclera will be spared. That is called hypercarotinemia. In hypercarotinemia, because of increased beta carotene intake, the sclera will be spared. That is, sclera will remain white. Then coming to chest, gynecomastia occurs in man, whereas breast atrophy occurs in women. Spider navy in the upper half of the body, that is characteristically in superior vena cava distribution, is again pathognomonic of chronic liver disease. Okay, I will explain about spider navy a little bit later. Splenomegaly, which is the most consistent sign of portal hypertension. What is the most consistent sign of portal hypertension? If somebody asks you, it is splenomegaly. That means if the patient is having portal hypertension, he will have a palpable spleen. Hepatomegaly, remember, in the initial stages of chronic liver disease because of alcohol, then at that time only we will get hepatomegaly. But on the later stages, that is in the stages of cirrhosis, the liver undergoes shrinking and we will get a small liver. So we can't say hepatomegaly is characteristic of a liver pathology because we will get small liver also. Then this is again another sign of portal hypertension, that is called caput medicae. That is, you can see the blood flows towards the umbilicus. Umbilicus is one of the site of portosystemic anastomosis. So we will get a dilated collateral vessels around the umbilicus. We call it as caput medicae. Again, leukonychia, white nails. Palmar erythema, clubbing. See, this is palmar erythema. You can see very carefully the central part of the palm is characteristically spared. Okay, central part of the palm is characteristically spared. This is called palmar erythema. Then of course testicular atrophy, edema, alopecia. Remember alopecia. Then skin pigmentation, bruising, all those are non-specific signs. Leukonychia is again a non-specific sign. It is not only seen in chronic liver disease, it is seen in other lot of diseases. It may be associated with drug intake, it may be associated with other systemic illness, chronic renal failure, everything. But palmar erythema is characteristic. Clubbing is not specific or pathognomonic to chronic liver disease because clubbing is mainly clubbing is mainly associated with inflammatory bowel disease and malabsorption. It is also seen in liver cirrhosis, but it is not pathognomonic of liver disease. Once that is done, let us go to a bit detail about palmar erythema and spider navy. See, what is spider navy? They are nothing else but small telangiectasia, that is dilatations of the small arterioles because of increased estrogen. Remember, in hyperestrogenic states, for example, in pregnancy, in women, all this 3 to 5 spider navy is said to be normal. But when the spider navy occurs in men, it is a sign of chronic liver disease. It may occur in hyperthyroidism, it may occur in pregnancy, but all these are normal, up to 3 to 5. But when it occurs in man, when it occurs in male, it is indicative of chronic liver disease. But still in male we can say up to 3 spider navy is normal, but more than 3 spider navy is suggestive of liver disease. And remember, spider navy help us to it will give an indirect evidence of the severity of the liver disease. For example, you are examining the patient on day 1, you see 4 spider navy, and on day 5 you see the patient is having 10 spider navy. That means the patient is going to much more worse liver condition. Okay, yes. So out of this, which all strongly suggest chronic liver disease? Remember, it is spider navy, palmar erythema, and ascites. Yes, I forgot to measure here. Of course, ascites. Okay, ascites. So remember, spider navy, palmar erythema, ascites, all these strongly suggest chronic liver disease rather than obstructive jaundice. When the patient is having obstructive jaundice, for example, carcinoma of the head of the pancreas, any gallstones, all those will produce jaundice. So we can't say icterus is a sign. When the patient is having alcoholic liver disease, what are the three things? Spider navy, palmar erythema, and ascites. Okay. Again, ascites is because of the portal hypertension, but remember the pathognomonic sign of portal hypertension is splenomegaly. As I told you, leukonekia, it is also associated with hypoalbuminemia, malabsorption syndrome, protein losing enteropathy like celiac disease, nephrotic syndrome. It is also associated with what other systemic illness also. So we can't say leukonekia is again pathognomonic. Gynecomastia, as I told you, loss of body hair, testicular atrophy, all those is because of hyperestrogenism. Testicular atrophy, gynecomastia, loss of body hair, all those are because of hyperestrogenic condition. And remember, in ask the patient to just extend their arm and forearm and extend their wrist. You can observe something called as asterixis, which is a coarse flapping tremors, which is a characteristic feature of hepatic encephalopathy. It is also seen in other metabolic encephalopathy like renal encephalopathy, uremic encephalopathy also. And fetor hepaticus is nothing else but the mousy odor, this bad smell which is mainly produced because of the mercaptans or sulfur compounds which will produce in chronic liver disease patient, that produces fetor hepaticus. And another one thing is Dupuytren's contracture, that is contracture of the palmar aponeurosis. In our hand we have the palmar aponeurosis. It will undergo contraction, okay, that leads to the so-called Dupuytren's contraction. And another thing, bilateral parotid swelling, that is also seen. These are all seen in chronic liver disease. But what is pathognomonic? Ascites, yes, then spider navy and palmar erythema. These three strongly suggest chronic liver disease than obstructive jaundice. Once this is done, let us see another important what are the features of liver failure, acute fulminant liver failure? Okay, the patient is in liver failure. What are the signs? Fetor hepaticus, because of, I told you, the volatile amines or mercaptans, flapping tremors, asterixis, then what? The alteration of sleep patterns, then lead neurological factors like spasticity and extensor plantar response. Babinski is positive in all metabolic encephalopathy. Okay, all metabolic encephalopathy. So fetor hepaticus, asterixis, okay, altered sleep wake cycle. In all these conditions, emergency intervention is recommended. You have to intervene emergency because the patient is having acute symptomatic liver failure. Anyone is present, intervene immediately. Find the cause, treat. Okay, immediately intervene in fetor hepaticus asterix. I am telling it is acute fulminant liver failure. Don't confuse this with what I have told prior. This is chronic liver disease. This is acute fulminant liver failure. Once this is done, let us go towards the end of this video where I will be just telling what are the different causes of hepatomegaly. As I told you, alcoholic liver disease. Initial stage we have hepatomegaly, then viral hepatitis, primary biliary cirrhosis, hepatic steatosis, autoimmune hepatitis. Late stages we will get shrunken liver. Then hepatocellular carcinoma, liver mets. Remember, right heart failure, lymphoma, leukemia, amyloidosis, Buercher syndrome, glycogen storage disease. All these are very, very rare cases. First thing, alcoholic liver disease, early stage. Don't say simply alcoholic liver disease, early stage. Autoimmune hepatitis, hepatocellular carcinoma, which is very common. Then liver mets is very common because especially in an elderly male with colon cancer, definitely he will be having liver mets. Okay, any abdominal malignancy first undergo metastasis into the liver. Okay, then primary biliary cirrhosis. I told you primary biliary cirrhosis is associated with clubbing. Liver cirrhosis, inflammatory bowel disease, primary biliary cirrhosis, all these are associated conditions in GIT which produces clubbing. So in this video I have told you the hepatomegaly, signs of liver failure and all those. And last but not the least, let us go for the grading of hepatic encephalopathy, so called as the modified West Haven criteria. What are the different stages in which the patient in hepatic encephalopathy present with? Number 1, 0, in which there is no change in personality, no flapping tremors. Here comes the question, in which stage flapping tremors is characteristically present? It is stage 1. And the flapping tremors disappears by stage 3. And the patient is coma in stage 4. Remember, it is not like the patient will always progress from stage 2, 0, then 1, then 2, 3. No. At any stage, the patient can present with you. For example, the patient can straight away, directly the patient can present in stage 1. Sometimes the patient can directly present in stage 4. It is not what stage 0, 1, 2, 3, 4. It is not like step-by-step progression. This staging will help us to just say the severity of hepatic encephalopathy. This is called as the so-called as the most famous modified West Haven criteria. Okay, remember flapping tremor is absent in 0, present in 1, disappears by 3, comma is stage 4. Just remember this. Okay,